Hi everybody, I am your Director of Nursing, Ashley. Joanne is recording me. Brittany's story is standing here. I'm going to teach you guys how to disinfect with the gust station, the transvaginal ultrasound. I thought this was the best way to do it since it's going to be hard to gather 30 of us into one room. I'm not going to stop this video, so it's going to be extremely clunky. If we laugh, I'm sorry. If I fumble, I'm sorry. Please forgive me. We'll just make it work. So this is my first day learning the gust, so bear with me. We will start with opening the products. We are at the west side location. It'll be different at the downtown location. At the downtown location, it is in the autoclave room. I will send pictures where everything is located for that location. For this location, we are in the procedure room, as you can probably see. And above the sink is where I stored the gowns and the masks. And I put the gloves over here, and they might not be over here because I moved them. Kelly and Sarah may prefer them over there, but we'll see. And then the Cydex, that is the high-level disinfectant, is over here, and the test strips are here, and the neutralizer for the Cydex is next to it. So all of these are things that we have to use for this whole system. So starting out, we will just start with opening. So say we get a brand new bottle and we need to clean the ultrasound, and we have our brand new machine and we need to fill it. So I will get my high-level disinfectant, and I would say, if for the shorties, because let's be honest, Kelly, Sarah, and Trixie are all pretty short, and I'm pretty tall, so this is kind of high up there, but we can't put anything under the sink. Once this is opened, this is extremely caustic and very, very dangerous, and so I would highly recommend getting the stool and grabbing it, so that in the possibility that somebody didn't tighten this, you're not placing it, or the potential to splash it onto you. So get that out, get the test strips. The neutralizer is to be used at a different time. So I'm going to also get the gown. So every time we use any Cydex or high-level disinfectant, we need a gown, we need the face mask with the shield, and we need gloves. And per the Cydex guidelines, Joanne, can I get the, I'll just use the red trash bag. Trash bag, only time you would need the red one is if you had bodily fluids, but any other time for any of the other products for this, you can just use the regular trash can. The nitrile gloves are fine. If you use a latex glove, it recommends that you double glove, so you can use these ones. So anyway, glove up. It's extremely warm in here, so I'm going to be very warm. So these are just isolation gowns, and they're just to protect your clothing because Cydex is so caustic. No, I think I got it. I was gonna say I could use help, but I don't know. Anyway, I think that's like a Velcro. Might be too fat. If you guys need bigger gowns at all, I didn't even look at the size of these gowns before I got them. But if you need bigger ones, let me know. Or smaller ones for that matter. And then the face shield. do not skip any of these steps. I apologize that you have to do all this in advance. It's for the greater cause. Okay, so I've got all my PPE on. I've also made a sign to remind you wear a mask, gloves, and a gown for your protection. This is a requirement. This is manufacturer's guidelines and per our policy, and Joint Commission will make sure that each of us know that this is a requirement. I've also placed up here, just while I'm talking about it, some other informative things of, since Sidex is so caustic, this gust station replaces a natural hood that some people would be used to if you've ever used high-level disinfectant. This replaces it, and so when it is on the on position, it uses the vents in here to discard any of the gases. So while the Sidex is in here, you never turn the gust off, because then all the fumes that are in here will fill the room instead of be released into this and into the filter. So there's that. Here's also just a warning that's required about probe placement. And then I placed the instructions that I'm gonna go over. I placed them right here, and they are also located in the book, which I'll go over with you and show you. Okay, so back to opening up the products. So this is the Sidex. Joanne, can you see me well?
Yes.
Okay. So this is Sidex. I am going to, it has a seal, so, oops. I'm high-level disinfecting the scissors. I'm actually going to change my glove because I pictured it. Don't much feel like losing my hand. Okay. So I have now opened the Sidex. For labeling's sake, since this is a brand new bottle, I'm going to put the lid back on. Like I said, for safety and for fellow staff behind you, make sure you put the lid on safely. I have my notes because I'm not a professional as of yet. I will be. When you open the Sidex, it is good for 75 days once opened, or per the manufacturer's recommendation for disposing of whatever comes first. So most likely the 75 days will come first. So today we opened it. So I'm going to put opened on 1/4/19 and expires on 3/20/19. There's also an area down here to put the dates, so I will overmark it. And just in case any of you guys have a hard time counting the days, we figured out that you can ask Siri what 75 days from today is, and she'll tell you. So don't count a calendar, ask for help. It was brilliant. Thank you, Brittany Story. Okay, so that's now labeled. And also noting, per Gritman's policy, and I have to look into Sidex a little bit further, it needs to be QC'd once you open every bottle. I didn't know this until we got here and we're doing this. So know that I'm going to be looking into that to get the actual QC equipment. So bear with me, that's to be in the future, very soon, but not right now. So I've labeled the open date, the expiration date on both locations. I'm also going to, over here is the expiration date, and it is August 22nd, 2020, and the lot number is there too. The lot number, we'll have to know that for when we're documenting. Okay, so the Cydex test strips are another component that you're going to use every single time you clean. These, let's see, they need to be discarded 90 days after opening. So these guys, I'm gonna put open on 1/4/19 and expire on 4/4/19. And then there's also a place on the side of the bottle that you can do the same thing. Okay, also note, these are very sensitive to light and to the air, and so don't leave these open for any longer than 30 minutes as it will destroy their efficacy. Okay, so I think I've got all that stuff. Now we can work into placing the Cydex into the gas station and how to clean the actual transducer. So it has the lock right here, so you just unlock it, and if you, I don't know if you want to move closer at all, Joanne, so you can see a little bit closer to the things. Right here are little tabs, and these little tabs are where it's going to hold in the ultrasound probe. Remember that the ultrasound probes, the transducer, the top of it is extremely sensitive. And so when handling and putting it and immersing it into the Cydex, you need to be extremely careful because those are very expensive and it's extremely sensitive. And this is going to hold that probe into the correct place. I've marked it and I'll show you what I'm talking about in just a second. So prior to loading the Cydex, I'm going to fill the rinse container. As you can see, it says rinse on it. This does not need to be anything more, which is going to be extremely difficult. I didn't even think about this. This doesn't need to be anything more than tap water. So I think now doing this, since we're like literally just doing this for the first time right now, I will get, so anyway, for demonstration's sake, I'm not going to fill it up right now all the way. I will get like a pitcher that we can, we'll do something. I will get something to make it work, because that's not going to work to fill this chamber up. Anyway, I would want you to fill the chamber up to this area right here. So like the first little lip. So you can place that once you fill it up back in here. And if need be, if we got some kind of dispensing device, you can leave it in here and fill up the rinsing device. So this other container, you'll see it says warning, high level disinfectant. This is where the Cydex is actually going to go. And Joanne, if you can point inside there, you can see I've marked it with a red line. That is as far as you're going to fill it. Okay, so I'm taking the Cydex, I'm opening it up, being very careful. Okay. So I'm going to close this tightly and securely, making sure that it's appropriately closed. Thank you, Brittany. and place it back. Brittany brought us the cup. This will work. Nothing fancy needed. So this can be just cool water. Just fill it to that lip. Okay, so now, sorry, my hair is like right on my face. Okay, so for right now, I'm literally going to read from this Gus logbook, fancy logbook at Westside that Joanne provided us. Inside of it, the very first part is the policy and procedure of just literally a step-by-step instruction on what to do. After that, it goes into Gritman's policy and procedure. This is talking about the QC, the quality control test that I was talking about that I need to figure out what to do. This is the log that you need to fill out every single time, no exceptions. This is something that Joint Commission will be pulling and looking at and finding the people who initial this and asking them how to use the Gus station. Guarantee it. After the logs is the Cydex instructions. I have highlighted all of the important things. I mean, everything's important, but like the step-by-step instructions of how to use Cydex. If you have any questions about Cydex, you can read through that. And then the instructional operational guide for the Gus system, troubleshooting, numbers that are in there, the filter life, we'll go over that in a minute, cleaning the system, all of that is in there. So, okay, so I will start reading. So you get done with an ultrasound and you don't necessarily need to bring the entire ultrasound machine in here. The one thing, if you were to leave this over in an exam room, what you would want to do is you would want to make sure you glove up. You would take a Sani wipe. First, you would wash, pretend there's gel on it from the ultrasound cover. You would rinse any of the gel off. You would gently dry the transducer. Now you're going to use your first Sani wipe and you're going to clean off any visual debris. This includes the cord. At this time, I would also want you to clean the ultrasound itself. Then you would discard of the first Sani wipe and you would move to your second Sani wipe. This is where you would proceed to do a full 2-minute wet time. This area right here, that blue part, is the area I was talking about that is extremely sensitive. Be very careful. For time's sake, I am not going to clean this for 2 minutes, but you get the point. Remember these red tops are 3 minutes, but we're moving to the purple top Sani wipes that Gritman uses, that's 2 minutes. So in the policy, I put 2 minutes knowing that we will be moving to those. So after you get done doing the 2-minute wet time, you let it air dry. Once it is air dry, I think I get down here, Joanne, if any of you, just for ignorance sake, if you guys have never done this, down here is where the transducers connect. You just turn it, so counterclockwise, and it just pops right off. The basic ultrasound transducer is not one that needs to be cleaned in the high-level disinfectant because it's not an endocavity transducer. So that one needs to be cleaned with a Sani wipe for the 2-minute wet time, let it air dry. and it can stay on here. Or at the downtown location, I cleaned it when I cleaned the other one today, and I placed it in the drawer with the transducer just for the sake of having it in the same spot. So you would remove it, and you would unglove, because it's all now clean. You would unglove and you would bring it in to this room. It is really hot in here. Okay, so I'm done with this. I didn't bring this with me. So now I have my transducer. Okay, now it says is when I'm going to glove, gown, goggle, because this has possibly already been done before, or I didn't do this prior, or this is when I'm going to be doing all this. I did this prior to this part, but anyway, that's when I would be doing the filling of the stations. Okay, so now is when I'm going to do my test. I'll show you, Jan, if you can really quickly. There is a pad up here, and this is for that to rest on safely. So while I'm testing, I can place this right here. Now I'm gonna grab those Cydex OPA test strips, and I'm gonna open one. And I'm also going to get a paper towel out and just place it right here. So it's blue to start off with. I'm just going to quickly immerse it, and then I'm going to place it on that towel. You need to wait 90 seconds. After 90 seconds, you can read it. There. So what you're going to be reading, also, so once I close it, you need to make sure that you thoroughly close the lid, make sure it pops. So what I'm going to be reading is just like a urine dip, the same kind of thing. It shows on the side, pass, fail, fail. So with these test strips, it says anything that is not a solid purple, so any inconsistencies that deviate from the purple means that the Cydex is no longer effective. Cydex, once in this station, is good for 14 days, or when that test strip deviates from the purple, whatever one comes first. So what I am going to do, which I should have done, but since we're just winging all this. So it's been about 90 seconds, and that strip is completely purple, no blue. So on a piece of medical silk tape or surgical silk tape, I'm going to, it doesn't have to be silk tape, it could be transport, whatever. I'm going to put Cydex actually maybe don't use silk tape because it bleeds. I used transport downtown and it worked really well, but we'll just do it since we already have it. Cydex, discard, and then what's 14 days from today?
18.
The 18th. Okay. So discard on 1/18/19. So this is just a visual reminder. It's also going to be in the logbook, but this can be removed. So that just needs to be discarded. And like I said, if you see any blue within this, it's going to surpass that. It's then going to be discarded. Discarding Cydex is not just a matter of throwing it down the sink. It requires to be neutralized. So I have not neutralized it, and I'm not going to waste an entire bottle of this. So my ask, and I'll speak to you guys at the staff meeting, is that the first person that comes across the situation where we do need to neutralize the Cydex, please call me and we'll do it together. It takes, I think, an entire bottle of this to be poured into the Cydex, and then once it's been neutralized for a certain period of time, you can then pour it down the sink. So do not pour Cydex down the sink. All right, so I've tested, we're good. I'm gonna place my test strips back where they belong so everyone can find them. I've got all my PPE on. I waited the 90 seconds, everything's good. I filled the rinse container with the tap water. Okay, so now is where we're going to place the probe inside the container. So this is where you are very careful. I have placed a red mark on the probes as indicators. So with these, how you handle it, I'm gonna actually switch places. So with your left hand on your thumb, you hold the thumb right above the strip, the red strip, and you hold the probe in your right hand. You place the probe inside of the Cydex and you immerse it until you get down to the red line. You push the blue button or tab back, you slide the probe handle in there, or the probe cord in there, and then you let go of the blue and it closes it in there. Whoop. Just kidding, that was a bad example. I think it's because that weight is pulling on it. Okay, so at this point, I am going to set a timer for 12 minutes. 12 minutes is how long the probe has to sit immersed within the Cydex. So I'm going to close this and I am going to let it sit. I have ordered little timers to go with each one of these stations. These should be here next week. Until then, use your phone. Again, for demonstration's sake, I'm not going to let it sit for 12 minutes. Okay, so assume 12 minutes has passed. I am going to read my instructions, and with the same handling procedures that I just did for placing it into the high-level disinfectant, I am going to use my left thumb above the red mark. I'm going to push back the blue tab, and with my right hand I'm going to pull the transducer up, being very gentle. As you can see, there will be large droplets of the Cydex. You need to make sure that you get the Cydex, as much of it off. And then I'm going to place it over into the rinse water. So placing it gently into the rinse water. I'm going to tab it in, and I'm going to let this sit for 1 minute. So again, timer set, sitting for 1 minute. While it's sitting for 1 minute, I can recap my Cydex because I am done. Cydex needs to be recapped and the gustation needs to remain on. Also, make sure that we are not leaving patients unattended in here with the gustation while we're cleaning. Okay, 1 minute has passed. So, oops, actually, just kidding. I'm gonna go back. 1 minute has not passed. What I'm going to do is, while the 1 minute is going, I'm going to proactively get a towel out, knowing that I'm gonna have this sitting out here while I refill the rinse water. Okay, 1 minute's passed. Okay, so following the same handling instructions, pull the probe out and place the probe on the towel. I'm going to take the rinse water. I'm going to empty it into the sink. And I am going to repeat that process of rinsing 2 additional times. So for a total of 3 rinses. Left thumb on red mark, right hand, place probe in water, push in blue tab, let sit for 1 minute, set timer. 1 minute. Okay. And then I'm going to repeat this process 1 more time. For sake of time, yet again, I won't repeat it 1 more time because I think you get the hint. For cleaning these, it says to use a mild detergent. I think that possibly we could just use the Dawn, or maybe I'll ask Brittman what they use. It says to clean it every day, daily, after the rinse. If you're going to especially be doing it multiple times in a day, just flush it and then you can place it back in. But for the daily cleaning, a mild detergent. And then once you're completely done, close it back up and then you can lock the gust station. Okay, so then you're going to remove and dry the probe. So, being very careful. Main Street, or downtown, excuse me, has some non-latex ultrasound probe covers that do not have the gel already in them. I will order some more because Westside does not have them. So for this particular instance, I'm actually just going to recover the probe with the little doodad. But according to our policy, you cover the transducer with the non-latex, non-gelled ultrasound probe cover. And then, because we need to get rid of these green towels, it doesn't have to be a green towel, it can be a washcloth. It needs to be wrapped. So, it needs to be a clean, so wrap it, a little papoose. And then I've designated, here at Westside, to make it as simple as possible, this very first drawer is going to be the transducer holder. At downtown, it is right the first drawer underneath where the autoclave was, where the gust system is. Make sure that you're not kinking any of the cords. Voila! Okay, close that. Then talks about flushing and refilling with fresh water, but I'm not going to refill with fresh water until I use it again. Place caps on, make sure that the gust is to remain on. And then all of us clinical staff are required to be competent and show that we're competent to use this. So we'll make sure that we all ask plenty of questions and thoroughly understand. And then, oh, just kidding, that's the other one. For logging, if you want to come over here. So I just got done cleaning the transducer. So on here, it says the Gus model number and the serial number. I'm not going to do that. I guess I should, but I'm not going to because I don't know how pertinent that is. Okay, so location and department, it's a little dark, but this would be MFM West Side Clinic, so WSC. At downtown, it's MFM DTC. Gus filter install date. Well, we didn't install it, but it's brand new today, so we will put 1/4/19. Gus filter change date. This is another thing that we're going to document really quick. So right up here at the top, it says that the filter needs to be changed every 6 months. Here is the PCI medical number that we would call to order the filter. So I'm going to, so that would be, what, like June, we'll put June 4th. So I'll put replace, definitely don't use silk tape, this is terrible. Replace filter. Six, 4/19. Okay. And I'm going to put this right up here. That looks horrible. I'm so sorry. I'm going to take this stuff off too because I'm done using the Cydex and it's crazy hot in here. So I'm going to discard the gown. Maybe this would be much easier if it wasn't tied. Okay. I'm going to perform hand hygiene. So if you want to come over here, Joanne. So the Gus filter change date is, point out the paper. The Gus filter change date, that's what we wrote on that sticker. So it's going to be the 6/4. 2019. Woo! Throwing paper around. So I'm drying my hands. Okay. So Gus filter change date 6/4/19. QC test strips. So initials and date. I didn't really QC these because we need to figure out that process, but if Joint Commission's gonna come anytime soon and look at this, they probably are gonna want to see that date, so we're gonna fib this one just a little bit. And so please don't tell anybody or show anybody this video. Date test strip bottle opened, so that would be 1/4/19. Do not use after, and that would be the 4/4/19. And then test strip lot number, which is right by the expiration. So 032432. Okay, and then I opened the disinfectant the same day. And then do not use after, it was 3/20/19, and the bottle's lot number, I highlighted, it's 824 0.0000075. Okay, disinfectant test date. So this was the 4th. Test time, what was it, 4 o'clock? So I'm put 1600, temperature. So this is, I got a order coming in, it's pending for a temperature gauge to come in. So I'm gonna leave that blank right now. And then my initials, and then the test strip passed, and I don't have any comments. If it failed, you would put side X replaced, you know, or side X discarded, new side X replaced, test strip performed, passed, and then you would do like a new one. But since everything was good, it's fine. I'm also on, since my initials AS, maybe somebody doesn't know who AS is. So I'm going to put AS, and then I'm going to put my name down here, Ashley Swander. There are a bunch of copies here. And then also, if any of these products begin to start running out, please let me know ASAP so that I can get them ordered. I think that is probably about it. So again, Westside, your products are up here. Your gowns and face shields are here. Gloves need to be used. Your Gus log, I am going to place right here. So, well, it covers that up, but, well, I'm not going to put it there. I lied. Because I don't want that covered up, because I don't want that Gus being turned off. I didn't think that one through. I'm going to put it right here. And then these towels, I'll just put them, I'll put them up here as well. These are just to cover the clean transducers. So I hope all of you learned how to use the Gus system effectively. If you have any questions, please feel free to ask. And we're all learning together, and woohoo for Joint Commission.